नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर जॉइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज एफबी लाइव सेशन. New feature that eGlobal Doctors have added is eGlobal Doctors Digital Health Hospital is coming up with new project called eGlobal Ayush. The project is for Indian folks working in USA, UK, Australia, and Europe. Do you worry about parents back in India? eGlobal Ayush packages will help you provide the medical needs for NRI parents in India. For more information, make sure you do visit eGlobalDoctors.com. eGlobal Doctors Digital Health Hospital, connecting patients across the globe to doctors all over the world. In today's live session, we will be exploring and providing more information about sinus infections, the do's and don't, in conversation with Dr. Jyoti Manekar. Dr. Jyoti Manekar is a family and obesity medicine specialist. She has over 15 years of experience in taking care of patients. She's caring, compassionate physician who likes to treat people, not just diseases. It's really nice to meet you virtually, Dr. Jyoti. Thank you for sparing time. How are you doing this evening?
Thank you, Kunjan. I am fine and love to be here.
Thank you, and pleasure is all ours because whenever you come, we get loads and loads of information. So what do you say? Without further, should we actually dive into today's topic?
I think that's a great idea.
Okay, so we are talking about the do's and don'ts of sinus infection. So I'm going to just start with a very basic. What is a sinus infection?
That's a very good question, Kunjan, because this time of the year, we're seeing a whole lot of sinus infections. Just because allergies have been around. The most commonly, I describe sinuses as bony boxes in your cheeks and your forehead and behind your nose. And usually these boxes are filled with air, so you feel very light. But if there is inflammation in these sinuses, they swell up, and that swelling causes a lot of drainage of fluid. So instead of having air-filled boxes, now they're filled with fluid. And when your sinuses are filled with fluid, you feel that heavy pressure type of feeling, and even you get headaches. So that's the most common thing about sinuses is they are inflamed and filled with fluid.
And that's why it hurts. You know, whenever I have that, it's like you touch here, the light is bothering me. Okay.
Yeah, usually it hurts when you touch those sinuses, or you may have a lot of drainage, and also it can give you sore throat sometimes. And sometimes the back pressure can go into your ears and you get the fullness of ears as if you're not able to hear clearly, as if there's fluid in your ears. So those are a couple of things that we see. And again, very common this time of the year. Spring and fall are the big times when you can see most of those.
Okay, so then my next question would be, at least I know what sinus infection is. Now, my next question is, what causes like sinus problems? What triggers it?
Sure. Now, the most common problem for sinusitis is viruses. Viruses cause more or 80 to 90% of sinusitis, and there are few of them caused by bacteria or fungal infections, and also there is allergy-related sinusitis. So it's viruses, bacteria, fungal infections, and again, fungal infections not very common, only in population which is high risk, like diabetics, and then allergy-related sinusitis, which is very common again.
Okay, so that could cause actually the things that you described, that could actually cause a sinus infection as well, or it could trigger a sinus infection?
Absolutely. Whenever there's inflammation in your sinuses, there's swelling and then there's fluid. So germs like that environment, it creates a little culture for them to thrive in. So that's the main problem is once there's congestion or fluid filled in those sinuses, bacteria and viruses multiply in that area pretty quickly. And that's why we get those sinus infections.
So then that's a perfect segue into the next question. So what are some common sinus inflammation that we may see?
So this time of the year, we see allergic rhinosinusitis, which means inflammation of the nasal passages and the sinuses. So again, there's blockage, and the blockage of the fluid causes a lot of backflow into the throat, causing a lot of sore throat issues. And then the pressure issues, again, like I said, this time of the year, allergic rhinosinusitis is very commonly seen. And then, viral sinusitis is another second common one. And the bacterial and fungal are less common one.
Okay, but they are there,
They are
and
already
somebody.
there. Yes.
Okay, perfect. So then now we know what is sinus. Now we know what causes the inflammation. I want to ask, what are the symptoms like of sinus infection? How would I know, someone who is not a SME like you, how would I know that I have sinus infection?
So most commonly people kind of have the nasal congestion. You'll see that voice changes. They have drainage. They complain about sore throat. And like I said, again, the pressure feeling, like as if you have a toothache sometimes, or the pressure on the forehead and cheeks. You may have pressure in your ears. Some people also feel like they have dizziness or vertigo when they have sinuses, something to be aware of. And of course, if it's an infection, it can give you fever. You can have tender neck glands. So those are the most common things that we see when you have a sinus infection.
So from my personal experience, I think I had a sinus infection. Sometimes we just become doctors and we treat ourselves that, sardi zukam, it will go away by itself. And it just stayed. Probably it loved me so much that it decided to stay for a long time. Then I got an ear infection. So is it possible to have the congestion and then it goes in my ear to have ear infection?
Yes, Kunjan, that can happen because our ears and our back of the throat is connected with a small tube called eustachian tube. And also the pressure is equilibrated between the two areas. Now, whenever there is inflammation, that gets blocked and you can have back pressure into the ears and a lot of sinus fluid kind of flows back into the ears. So you could get like ear fluid and ear infections sometimes from sinuses. But again, it is a lot of times known as common cold, which starts with nasal congestion and then may eventually kind of get so bad that it could again cause other things like sore throat, pharyngitis, or ear infections, ear pressure, headaches, and so forth.
Okay. Well, good to know. So don't become a doctor like I did. Please don't make that mistake. If you have an issue, go and see an expert. So I just want to tell our listeners and viewers that we are live on Facebook, YouTube, Twitter, LinkedIn, and Instagram. So hop on your social media, whichever one you prefer. We are available everywhere, and we bring you interesting topic week after week. If you are looking for an expert second opinion for cancer treatment, eGlobal Doctors Digital Health Hospital provides you with platform access to top oncologists from across the world and consultation pricing starting at $199 only. And if you are joining us, we are talking to Dr. Manekar about do's and don'ts of sinus infection. So we know what it is, what it causes, what are the symptoms. How can I avoid that I don't get sinus infection?
So like every other infection, it is very commonly spread from droplets, meaning if someone has it and if they have coughed or sneezed, if there's droplets around, you can probably catch that. So hand washing is very, very important. And if you touch your hands and if you're kind of working all the time, and then if you touch your hands to your face, you have brought that infection to yourself. So those are things to kind of be mindful about. Hand washing helps to reduce the number of infections, definitely.
Okay, so wash your hands and self-hygiene is very important if you don't want sinus. Okay, so I have a question that I got from our, do you need a sip of water or something?
I think that would be a good idea because I've been talking all day long.
Okay.
And
so why don't you get a sip of water? I'm gonna announce because eGlobal has a lot of features. I'm taking this time to announce about a new feature. New feature that eGlobal Doctors is launching is prescription shipping services. Georgia state only, but with the rate eGlobal is going, we might have these services open for other states, but right now it's Georgia state only. eGlobal Doctors have partnered with Sugar Pharmacy to deliver medicines to the Atlanta local community. Patient information will be shared to Sugar Pharmacy and they will contact you by regarding your prescription and details. Do visit eglobaldoctors.com. So should we continue? Okay. Okay, thank you. So we know what we can avoid. Self-hygiene is very important. Like doctor mentioned, keep washing your hands. So someone like me, how do I know if I have sinus infection or this is the allergy? Because the weather is changing, pollen is everywhere. So what is the difference between allergy and sinuses, and how do I know what do I have?
Sure. The most common thing is viral or allergy related. And this time of the year, allergies are very common. So what usually I suggest is treat your sinus inflammation by decongesting first, no matter what kind it is. That means if you remove that fluid from there, then it's likely you'll have bacteria and virus thrive in it. So decongestion is the first line of management of any kind of sinus, whether it's viral, bacterial, allergies related, or anything. So rinse your sinuses, called saline nasal rinse, or you could use a neti pot to clean your sinuses. If you can do the good old grandma's treatment, where you boil water in a pot, inhale the steam, that loosens up the mucus, so that'll let it flow. And when it flows out, then again, the sinuses are cleared of the fluid, and that helps a lot with it. And also taking an anti-allergen or antihistamine helps a lot to decrease the drainage into the sinuses, and that can help reduce that pressure and reduce your symptoms. And most sinuses, whichever kind it is, we treat with symptomatic treatment, meaning decongestion. We can use all the things that I said, like saline rinse, and then you could use Claritin or Zyrtec or any of the antihistamine. You could use a light dose of steroid nasal spray to kind of shrink those swollen sinuses. You can do that once every night. And those things help to reduce the inflammation. And 9 out of 10 times that can fix the problem.
Okay. So regardless if it's allergy or if it's sinus, the treatment starts based on the symptoms that one is showing.
Exactly. And again, if you have fever or swollen lymph nodes, or if your symptoms are lasting more than a week, then we consider antibiotics. But routinely, we don't recommend antibiotics for first 5 to 7 days of problem. Only if they have high-grade fever and they have severe tenderness or pain on touching your sinuses, then we think about doing antibiotics. But for most allergy-related sinusitis, again, like I said, it's allergy-related, so there's no infection, so you don't have to have antibiotics. Unfortunately, a lot of people run for antibiotics. Every time they have a sinus congestion, they all want antibiotic. But again, that's why I wanted to kind of make this talk, because at this time of the year, people very commonly seek antibiotics, and that increases their risk of antibiotic resistance. So very, very important to kind of avoid that. So 9 out of 10 times, like I said, if you use the warm compresses or steam inhalation, over-the-counter Claritin or Zyrtec or antihistamine, and then the Flonase, 90% of times it gets better. And it's time. And then avoid things like, bananas and milk, which make the congestion worse. So you're treating it by yourself first. So let's say if it's lasting more than a week, and if you have fever, worsening of symptoms, it's not getting better, or it started getting better and then it got worse, those are the times you definitely want to go to the doctor and get some additional treatment.
Okay, perfect. Good to know. So before we got interrupted, there was a question on our chat. So I'm going to go back to that question. So the question is that I have frequent headaches. Could this be a sign of sinus disease?
Yes, some people have chronic sinusitis, meaning they start with an acute issue, and then if it's not well treated, the fluid stays in the sinuses. And over time, if it's staying more than 4 to 6 weeks, we call it chronic sinusitis, which means they can have this pressure and headaches every day or most days of the week, or whenever there is increased pollen count, or if there is a weather change and the congestion gets worse, you start having these headaches. And that can happen in chronic sinusitis-like condition.
Okay. Good to know. So at least we know the distinction of allergies and sinus, and hopefully whoever asked this question on our live, thank you first of all for asking the question. This is what makes it fun when the sessions are interactive. So thank you for listening and tuning in, and hopefully got the answer that you were looking for. If you have any follow-up question, we are taking the questions, so please don't hesitate, put the question and we'll try to answer for you during this session. So are they, like you mentioned, banana and milk, which I did not know. Banana is the easiest thing for me because I don't have to do anything, don't even have to grab a knife, you just peel and you start eating and it's filling. So any other food that we should stay away when we have these sinuses, or can a food cause actually or trigger a sinus?
Sure. I mean, the most common ones are these two. The other things that I usually tell people is watch out for cold stuff. If you're drinking a lot of cold or ice cold water or cold beverages, then that definitely makes the congestion worse. So imagine if heat opens it up, makes your sinuses feel better. Remember, when you have congestion, you take a hot shower, it feels like it opens up and makes you feel better. But at the same time, if you're consuming a lot of cold products, obviously the congestion gets worse, everything tightens up, and you feel bad. And the other thing is sweet beverages, or if you drink a lot of juices or sodas and things like that, that is a lot of sugar, and sugar kind of feeds the infection. So usually try to avoid things like sugary beverages. So those are things I usually tell my patients is stay away from those things until you get better.
But sweet helps me forget my stuff.
I know. Temporarily, for sure.
Okay, so bananas, milk, and sweet and juices. So please stay away if you are dealing with sinus infection.
If you want to get better quicker.
Yeah, yes, that is also true. And no antibiotics. So yes, stay away from them. One thing that has worked with me personally is one of my friends makes really good rasam. It's spicy, it's hot, it's warm, and it's really spicy and it opens my sinuses. So is this a myth, or does something like this really works?
Sure. I mean, we haven't particularly studied that, but anything that opens up your sinuses, and a lot of times we do have some Ayurvedic type of medications which have the components of these things. So anything with pepper or, cloves seem to kind of open up or feel better whenever you have a drainage or when you have cough. These things feel better. So in fact, if you have a cough, a lot of times I recommend using ginger and honey, a fresh ginger and honey mixed together. It helps cough a lot. So a lot of times I don't recommend any medications over the counter for cough, just because they have a lot of Sudafed and epinephrines. So whenever there is those products, the Sudafeds increase your blood pressure. One, second, they dry up your sinuses. So it feels good for a day or two. And then as soon as the moisture comes back in, these sinuses swell up and then you feel congested again. So that's not the best way to treat it. It's like going in and out. So using the wrong treatments also causes a lot of what is called the chronic sinusitis, because you never fixed it. You just were trying to patch it up. And whenever the swelling kind of comes back or the moisture comes back, the swelling again, it happens. So be mindful about that. And also there is Afrin, or a nasal spray that people use a lot to feel better. And then it's good for a day or two if you do have to use it. But if you use it chronically, then what happens is every time you use it, you feel better. So you tend to keep using it. And then after 2 days, you start having what's called recurrent sinus inflammation. And that can cause chronic sinusitis as well.
Okay, perfect. Thank you for sharing that information. So at least we know a home remedy is available. Don't rely on the other stuff. I have another question that came from our live session. And the question is, can sinus pressure cause brain hemorrhage?
Not really. Not the sinus pressure is, again, sinuses are here and behind your nose. There is one of the rare conditions, which is a mastoid issue, but that's significantly rare. If there's inflammation there, that goes to the brain. But again, it does not routinely cause any of that.
Okay, so thank you. Whoever asked the question, you got the answer. The answer is no. You should not worry about it. It's not going to give you a brain hemorrhage or a brain. I don't know what that word is, but maybe the word is injury, but it's misspelled somehow. But yes, the answer is no. Perfect. So let's go back. So we know sinus lives here. But can it go to the lungs? Can it spread in the lungs?
Absolutely, because the drainage is happening in the back of your throat. So the drainage can go into your throat, cause infection or pharyngitis, which is the sore throat. And it can trickle down into your lungs and cause lung infection. And lung infections are of two kinds. One is bronchitis, and the second is pneumonia. More commonly, bronchitis, which is inflammation of the airways that kind of take the air down into our lungs. And that can be commonly seen. Again, 9 out of 10 times, those are viral as well. So again, the treatment is treat the sinuses with decongestion. And you can use inhaler, like a Nabuterol inhaler, to help open up your lungs so that you can get air in and recover quicker. So those are the two common ones.
Okay, perfect. Thank you. So before I go to my next question, let me quickly tell that eGlobal doctors have started new diet consultation, nutritional coaching to reverse chronic diseases. Start with 2 3-week diet consultation. They are multilingual nutritional coaches, and they have different programs. It's 3 weeks or 3 months, depending what your need is. They will help you understand the root cause of the problem, take in-depth case study. No fad diets are prescribed. People will understand what is mindful eating. And if you're still thinking about it, schedule a free consultation with their top-class nutritional coaches and visit and register today at eglobaldoctors.com. Book your appointment for a proper nutritional coaching. So let's get back to our sinus now. So what happens if someone leaves their sinus infection untreated?
Sure. One is they'll suffer the pressure and the headaches, right? The second thing is what I say is sometimes they turn into chronic sinusitis. So frequently I tell, when it's acute or when it's like the short-term sinus inflammation, it's good to go ahead and treat with sinus rinse or saline nasal rinse. And then the second thing is decongest with warm steam inhalation. So that helps. And then if you have allergy related, you can certainly do the Flonase nasal spray and Claritin or Zyrtec. The other product over the counter that is available is Mucinex, which is also called guaifenesin. So that can be a tablet that can be taken twice a day, and that helps to break up the mucus and helps it drain. So once it drains out, like I said, 90% of sinuses get better. Only 10% are the ones that need a little bit more aggressive treatment, especially let's say if people have an anatomical problem in their nose. So if they have a deviated septum, then anatomically, the drainage of the sinuses on that side may be poor. So usually they may get a unilateral or one-sided sinus inflammation often. And they always come back with saying that, okay, my sinus is swollen or it hurts. It feels like a toothache on only one side, the right side. And that time that we think about, okay, if there is a deviated septum, we need further workup with an ENT. And if there is an anatomical issue, that probably needs to be fixed surgically. So just to prevent chronic sinusitis, that can be a condition that can be treated. But again, 9 out of 10 times, if you decongest your sinuses, that helps a lot.
Okay, perfect. So make sure it does not go untreated. Give it proper treatment so you don't suffer. Like doctor said, that's perfectly put together. If you don't want to suffer, treat them right. So you did touch upon it. I want to ask about natural, remedies or improvements. And you said steaming or honey ginger. Besides that, any other how we can treat it naturally?
One other thing that I usually tell people is if they do breathing exercises for whatever reason, it helps a lot. In fact, I had chronic sinus issues for a long time. And when I started doing breathing exercises, it helped me a lot. So a lot of times we ignore the common things that are present around us. So breathing exercise like, Anulom Vilom is a big one that helps to move your air from one sinus and, expel out the other one. So that helps a ton. So, try those things. Those are definitely helpful. Don't ignore them. And a lot of people, again, feel like, okay, if they have congestion or sinus problem, they need to get it treated traditionally with antibiotics, but it's not the case. The second thing I also commonly find here lately is because of reflux. There is silent reflux that happened because of our lifestyle where we started eating late in the nights. So when we eat and go to bed, obviously everything that's sitting in your stomach is going to move up. And that regurgitation or reflux of food can also cause sinus infection because that's going up now. So it's very, very important to kind of eat earlier in the evening and not eat after 6 p.m. or at least have 4 hours before you lay in the bed. That reduces your risk of reflux and that reduces the risk of sinus issues. So some things that you can kind of do to prevent it would be, again, eating early, do the breathing exercises, and use your hand washing techniques to prevent it.
Wonderful. Thank you for that insightful information. I did not know about breathing techniques, so something definitely I learned. So let me double check if we have any more questions. No, I don't see it. So with that, it's a wrap. Thank you so much for sparing time. eGlobal Doctors is one complete healthcare platform solution for all your medical related issues and questions. And Maze ki Baatein, these services are available to you at your fingertips. You don't even have to move an inch. Take your phone, all you need is phone and internet, and that's it. You can just book an appointment. So before I let you go, Dr. Jyoti, any word of wisdom you want to share with our viewers?
Absolutely. I think the top three things that I like to kind of remind people is sinusitis is inflammation of your sinuses, and it's very common. And 9 out of 10 times you can treat with decongestion and work on it at home, basically, with steam inhalation and antihistamine and nasal spray, especially light dose of corticosteroid or steroid nasal spray helps. So that can be the best way to fix it. And drink a lot of water, because also that liquefies the mucus and helps it drain easier, so it's not thickened up. Avoid products like Afrin or Sudafed, which are over the counter, that usually thicken up the sinus. Makes you feel better for a day because they kind of sucked all the water out of it, and they kind of thicken it up. So you feel better for a day or two, and then it gets worse. So try to avoid those products. And then lastly, try to do regular breathing exercises. Those help a lot. Avoid things like bananas and milk when you have the actual congestion. Of course, they're good things for every other time, but when you have a sinus congestion, definitely try to avoid that. And basically, vitamin C is something that's recommended, especially when you're sick. It's good to have that. So usually I say eat a lot of oranges. That gives you lots of vitamin C. Usually orange juice has a lot of sugar, so I say avoid sugary products altogether when you're sick, because again, your bacteria and viruses thrive on sugar, so stay away from sugar. And cold products, because again, cold brings the congestion together, heat opens it up. So those are a couple of things I would like to remind people, that again, sinuses are easy to treat and easy to treat at home. So you don't have to get antibiotics for every sinus inflammation or infection. 9 out of 10 times you can treat it at home, and then very few of them need antibiotics, especially if they're lasting more than a week. If you have fever, or if it starts getting better and then gets worse, definitely you want to see the doctor. Or if you have only one-sided sinus inflammation all the time, you may want to look and see if there is any anatomical issue or deviated septum or something, and get further imaging or see an ENT specialist for that.
Okay, perfect. Thank you for that. Wonderful. You summed it very well together. So if somebody joined us late, I love the summary you provided. They know what exactly they have to do, and they know what they don't have to do. So thank you for that. So with that, this is RJ Kunjan signing off. Sayonara till we meet again. Stay tuned. We will be coming up with new topics next week. Keep smiling always. Thank you.